I want to delve into why buying potatoes will actually get you a dental discount. As you know, we've seen an entire foray of entry points of big tech e-commerce giants into disrupting primary healthcare. So Dollar General last month, in fact this month, announced the appointment of a chief medical officer, and their CEO says that their direction that they're taking with their 17,000 stores, some of them or many of them in rural areas of US, will provide full service offerings on healthcare to their customers. As you know, Dollar Store is a discounter store and has a fairly good what we call as footfalls into their stores. Now they're not alone. So Apple, Amazon, Google, Walmart have all made their what we call as dipping their toes into this healthcare market. Apple is on a device drive combined with aggregating patient data through EHR records. Amazon is on a pharmacy drive on the back of PillPack acquisition combined with significant technology push and acquisition push into telehealth. Then you have Google, which is pretty aggressive in collecting patient data and organizing records and providing analytics to hospitals, etc. And by the way, as you know, Google acquired Fitbit. And Fitbit made an interesting deal with LifeScan in tracking data and integrating data between Fitbit as a device and other monitors and devices of LifeScan for diabetic patients. Now, on a fun note, I call Google is the place where devices go to die. But hey, they're great at data and analytics. Now, Walmart is not left behind. Walmart has tried opening clinics, and they want to be opening super health centers, and they have a very good competitive position on it because almost 1 in 6 Americans live within a 10-mile radius of Walmart somewhere, and they want to use their physical locations as an advantage to disrupt the healthcare market. But Walmart did one more interesting move this year, which is that they actually got a patent from Toronto University to manufacture insulin, and the patent that they got was at $1 with the condition that they would make it affordable to all Americans. And as you know, insulin is extremely expensive in the way it is serviced today in the market. Now, in all of these examples, healthcare we know is not an easy nut to crack. It's almost a multi-trillion-dollar market. Whether you're a technology giant, whether you're a pharmaceutical company, all of these companies struggle with both the regulatory environment as well as the dynamics of how diagnostics work on the ground, the talent landscape between clinicians, nurses, doctors, all of that. So it's a very, very complicated game. And obviously, healthcare in the US is a hotly debated topic. And it only works if you live in a country called Switzerland. So let me now decode for you what I think are the 5 success factor formula points to get into healthcare as a business for either a technology giant or an e-commerce retailer in order to do that. Now, first, you got to have the ability to convert the network effect that you have in the digital landscape and the physical landscape as a seamless one singular flywheel. It's very easy to say, I'm going to get shoppers back over and over again with my discounting or the store layouts, etc. Or I'm going to get people addicted to my social media apps and purchasing behavior. But combining the two is not that easy as you think. So first is that you must be able to combine the physical network and the digital network. Second is you got to have a brilliant interface play. So obviously, there are very few companies like Apple that have combined hardware with software capabilities. With telehealth coming in, with Apple Watch doing multiple things, with Fitbit doing multiple things, there is a huge push in medical devices industry for diagnostic capability at home. So as the interface improves, as the device plus software strategy improves, you are going to see a much larger disruption by the technology giants on the healthcare business. The third is partnership with physical healthcare locations. I can have, let's say, for example, a watch tell me that I have low blood sugar levels or oxygen levels, but I still need to go to a physical clinic for further care. So can these companies form partnerships with clinicians, clinics, hospitals, where my at-home care combines seamlessly with hospital care or a primary physician care? And those partnerships are very, very critical. The third is, the fourth is really direct partnership with manufacturers. That's the Walmart example with insulin. If you can directly form partnerships with manufacturing companies to manufacture generic drugs, the overall cost of your service and your prescription drugs comes down. And it's very important because unless there is a significant lower cost factor, it doesn't really make sense for me to be on a platform getting medical care when I can get it at the same level with an in-person physician care in my primary clinic. The last one is interesting. We have seen a significant play for medical healthcare professionals by technology companies. For example, in 2019, Apple was one of the largest hiring companies of cardiac PhDs. And we've seen this go more and more. So, how will that talent landscape play out? How do these companies plan for it? The pressure it causes on the primary healthcare system, because all of these healthcare people are going to go join big healthcare companies or technology companies. So you have to figure out how will you staff your organization and build the capabilities in order to play that. So the more you shop in Walmart or in Whole Foods, and the more reward points you get on your Prime membership, most likely the cost of your insulin will go down. And therefore, it's very, very important to understand the equation of saying, it's not just retail, but it's outstanding service when I want it the way I want it, and you apply that model to healthcare. That is this month's Curious and Quirky from my side. And let me open up the conversation with all of our course leaders. Alan, over to you.